Today, we're going to take a moment to learn some possibly life-saving information about the fifth leading cause of death in the U.S. that is actually treatable and preventable. We're talking about a stroke, and this is the perfect time to go over this since May is Stroke Awareness Month. Dr. Kara Sands has the important details for us. Doctor, thank you so much.
Thank you so much for having me. Good morning.
Well, let's start out with just getting a general handle over what is a stroke.
Sure. So starting off with the basics, a stroke there are two types of stroke. There's ischemic stroke, and then there's hemorrhagic stroke. So anytime that an area of the brain doesn't get the blood supply that it needs, it can be injured, or if blood spills out of a blood vessel into the brain, pushing on the brain where it doesn't belong, it can cause injury to the brain as well. Approximately 87% of strokes are ischemic strokes, cutting off blood supply, and the rest are hemorrhagic strokes.
And of course, acting fast is going to be important to this. So what are some of the symptoms we should be looking for, whether it's ourselves or if we see somebody else experiencing it, so we know that's what's happening?
Absolutely. So acting fast and knowing that time is brain are probably the two most important things. So the majority of stroke we can think of in the FAST acronym. So F standing for facial droop, facial weakness, asymmetry of the face, doesn't really look lined up. A for arm weakness, arm drift, weakness on one side of the body. S is for speech, any speech disturbance, slurred speech, inability to get the right words out, or someone's talking to the patient and they're just not seeming to understand what's going on. And then the T is for time. Time is brain, time to call 911, and what time did the symptoms start. The quicker you can get an acute stroke patient help, the more tools we have in our toolbox that we can offer for that patient to help them and prevent further injury to the brain and to prevent disability.
And of course, at the beginning, I talked about this being treatable. Talk to me a little bit more about the treatments, including what we can do while we're having the stroke and possibly doing some something to help us even before we can get to you.
Sure. So the most important thing is if you think you or someone that you know nearby and love dearly might be having a stroke or a TIA, again, calling 911 is the most important thing so that you can be taken by ambulance to a hospital that knows that you're coming, that is aware that you are concerned for a stroke patient so that you can get the urgent evaluation and treatment that you need. However, backing up to the patient awareness of having symptoms, making sure that if the patient cannot communicate effectively to answer questions about what they're experiencing, what medications they take, what their history is, it's good to have somebody who knows the patient well to come with them to share that information with the acute stroke care facility. Additionally, it's important that people will ask me, Dr. Sands, well, should I take an aspirin? They say if I'm having a heart attack, I should probably take an aspirin while I'm waiting on the paramedics. I actually encourage people not to do that because it's very common for acute stroke patients to have troubles with swallowing, and the last thing we want is a medicine, a pill, an aspirin to end up in the lungs where it doesn't belong to cause more problems and aspiration.
Doctor, this has been great information that you have given us today. I want to thank you so much again for stopping in with us.
Thank you so much for having me. Have a great day.
Don't go anywhere. The Morning Blend will be right back.